you for being here today. Hope this sounds okay. I'm remote on a laptop, so we'll give this a go. But so back on January 21st in 2020, when we had the first U.S. case of COVID right here in Snohomish County, we really had no idea what the future might hold for us. I think we had all seen the pictures and news coming out of China and their need to build hospitals quickly, and it was the information coming to us was rather frightening. But none of us had lived through a global pandemic of that sort of scale, and we just really didn't have a lot of information about the disease. We assumed we would be seeing some sickness and death, but we weren't sure about the scale. We knew our healthcare system would be put under really tremendous strain. We knew our economy would take a significant hit, but we didn't know how hard we would get hit or what all the impacts would be and how it might ripple across our community in our county and frankly state and country. So even with the unknowns for the last 18 months, we've really focused on a few primary goals. It's protecting lives, protecting those who are most vulnerable to COVID-19, protecting the healthcare system, and doing all we could to support those who were experiencing the economic impacts of the pandemic. Of course, when the vaccines became available, we were ready to roll out mass vaccination sites and otherwise support getting shots into the arms as quickly and safely as possible. So today we're winding down our response to the pandemic and really focusing on building our infrastructure for recovery. There's still a lot of unknowns about COVID-19, but we have a system in place now to ensure we can adjust and respond to anything that comes our way. All our partners deserve a really great deal of credit and thanks for working together cooperatively towards the health and well-being of the public in our county. So thank you. There are really thousands of people that have been hard at work for the last 18 months, from our team at emergency management to the Snohomish County Health District, fire workers, EMS, first responder community, cities, towns, tribal partners, doctors, nurses, and other medical staff, all the way to grocery workers and truck drivers. So just many, many thanks and recognition and appreciation. We also really need to recognize those who are out of work and struggling, parents and teachers who had to quickly transition to online and at-home learning, those who lost loved ones or really struggled with COVID, the disease. This has been a challenge to all of us like no other we've ever experienced. So just everyone I know had a role getting us through the 4 waves of this pandemic. We are stronger and more resilient today as a result. Thank you to everybody. So if we don't want to let down our guard, even as we transition to recovery, so keep those protective measures, and we're going to be very watchful and mindful and ready to take whatever action we need. I especially want to thank all of you, representatives from the media, who've helped us communicate with the public over the last 18 months. You know, our goal was to get good information and the truth as best we knew it and could tell it out into the communities. You've been instrumental in that. You've really helped save lives. So thank you for being here every week, and thank you for transmitting that information. It's hugely important and greatly appreciated. So we're not going to have standing media availability more. We will continue to communicate as often as necessary, and we can have these in the future if need be. So with that, I'm going to hand it off to the Snohomish Health District Health Officer, Dr. Chris Spitters. Thank you.
Well, thank you, Executive Summers, for those comments, as well as all of your and the county's support through all of this. Good morning, everyone. Thanks for joining us again on these weekly briefings. It's been over a year. And again, as Executive Summers mentioned, you've been essential in our efforts to keep the community informed. Though this is the last of our scheduled virtual media briefings, I want to emphasize that the COVID-19 pandemic is not, I repeat, not over. We've made a lot of progress thanks to the community's effort to reduce the spread of illness, containment efforts like testing, isolation, contact tracing, and quarantine, and above all, readily available vaccinations through our mass sites, pharmacies, healthcare settings, and what have you. However, we are still seeing new cases and outbreaks throughout the county. In fact, for the week of July 4 through 10, this last week ending Saturday, 384 cases were reported. That's a 36% increase from the prior week's total of 283 cases. Our rolling 2-week case rate didn't show quite that much proportional increase because it's stretched out over 2 weeks. So that went up from 70 to 80 cases per 100,000 population for the 2-week period ending July 10. You can see all these figures on our case count page on our website. This increase occurs on the heels of the governor's statewide reopening is somewhat concerning. We also know that cases from gatherings around the 4th of July are not yet reflected in what we saw last week. So it seems likely that we will see another uptick in case counts next week. Around the country, many communities are seeing rising case rates or at best plateauing of declines. As more pre-pandemic activities resume, I urge you to remember that COVID is not gone and still is spreading in Snohomish County and elsewhere. If we want to keep ourselves and others around us healthy, we need to maintain many of the prevention measures that we've been emphasizing for well over a year now. First and foremost, if you're not yet vaccinated, get vaccinated as soon as possible and complete the full 2-dose series. Next, the Secretary of Health's recently modified masking order does remain in effect. If you are not yet fully vaccinated, meaning you're 2 weeks past the last dose in your 2-dose series or 2 weeks past the single-dose Johnson & Johnson vaccine, you should be wearing a mask whenever you are indoors in public or commercial spaces, as well as when you are outdoors if spacing of 6 feet from others outside your household cannot be maintained. And everyone, vaccinated or not, must continue to wear masks on public transportation of all kinds, in healthcare settings, in schools, in homeless shelters, and in jails. Even if there is no firm 6-foot distancing requirement at venues or gatherings, particularly outdoors, it's still a good idea to minimize close contact, try to spread out from non-household members, and if you can't maintain that distance, put on a mask, especially if you're unvaccinated. Stay home if you're not feeling well and have symptoms of COVID like fever, cough, congestion, body aches, and get tested. Wash your hands thoroughly and often. Follow isolation and quarantine guidance if you do end up being diagnosed with COVID, or if you've been exposed to someone who is ill with COVID, make sure you follow the full quarantine. And again, respect the distance from others you do not live with. Last, I'd like to suggest that if you run a business or other enterprise that permits vaccinated patrons to go mask-free, but does ask unvaccinated persons to wear a mask, that's great. That's in alignment with the Secretary's mask order. But if you don't have the capacity or the ability to sort out who is vaccinated from who is not, or to make sure that those who are unvaccinated continue wearing your mask, I think this is an opportunity to consider simplifying and improving things by just asking all of your patrons to mask up, especially in indoor venues. And I'll say it again, if you haven't gotten your COVID vaccine yet, please do so as soon as possible. If you have questions or concerns about getting vaccinated, talk with a trusted healthcare provider. If you cannot yet be vaccinated or are choosing not to be vaccinated at this time, please remember to wear a mask in shared indoor settings such as stores. As I was alluding to earlier, we saw an uptick in cases over the last couple weeks, and we also saw an increase in COVID-associated hospitalizations around the time of the greater hospital surge that was related to the recent extreme heat event that peaked 2 weeks ago. Now, some of these, and when I say an increase, we went from the mid to high teens the number of people in the hospital with COVID up to around 30 for a couple of days. That caught our attention. But after we looked through it, many of these were people who came in with symptoms related to heat or to trauma or other medical conditions, and then they tested positive for COVID while seeking care during that hospitalization. The number of people hospitalized with COVID has since come back down a little and stabilized in the low 20s. Hospital leaders locally reported that most of that hospital surge a couple of weeks ago was not specifically heat or COVID related, but a variety of acute medical problems, essentially more of what usually comes into the hospital, but in higher volume and possibly precipitated by or I would say likely precipitated by the heat, even though they weren't specifically heat-related illnesses. We're still seeing a number of people hospitalized with severe COVID, and we will continue to monitor hospital capacity, one of the key metrics of our community's safety in the context of this COVID-19 event. I'd also like to touch briefly on the COVID variants. We know that variants of the SARS-CoV-2 virus that cause COVID are present in Washington State and Snohomish County. This includes the rapidly emerging Delta variant, the one B.1.617.2, originally noted in India, as well as the Gamma variant, also known as P1 and identified initially in Brazil. The Delta variant is about 60% more transmissible than the previously dominant circulating strain, that B.1.1.7, now known as the Alpha strain. And this Delta variant is likely to replace other strains in Snohomish County, Washington State, possibly throughout the country over the next several months. Given this emergence, and just to give you an idea, it's about 25% of sampled cases up through early July are this Delta variant. Given this emergence occurring in sync with reduced mask use and greater mobility and mixing of people, it's reasonable to anticipate that we may be at the start of hopefully a small fifth COVID wave. But if unchecked, it could push an already strained hospital system beyond its capacity limits. Fortunately, existing vaccines remain effective against all circulating strains to date, as do all of the prevention measures I mentioned before. And the vaccines are particularly effective in terms of reducing risk of hospitalization and death. So, vaccination continues to be a crucial tool for protecting our community. If you receive the Moderna or Pfizer vaccine, make sure you get the second dose so the vaccine is effective as possible. With only one dose, you're only getting partial protection. If you did not get your second dose, it's never too late to do so. Although the goal is to get that second dose at 21 to 28 days, and there's some guidance around trying to get it done within 6 weeks. The reality is that it's never too late to get that second dose. So even if you got your first dose 3, 4, 5 months ago and you haven't gotten the second, go get that second dose. You will not need to repeat the first dose. So the best protection against the variants, again, is to all do our part to prevent the spread of disease, to get vaccinated and follow the prevention measures I've discussed earlier. The Health District has also received some questions about whether booster doses of COVID vaccines are needed. We are continuing to follow guidance from the Centers for Disease Control and Prevention, Food and Drug Administration, and CDC's Advisory Committee on Immunization Practices. As CDC and FDA noted, we are fortunate to have highly effective vaccines that are widely available for ages 12 and up in the U.S. Fully vaccinated people are well protected against severe illness and death, even in the context of the currently circulating variants. They do not need a booster at this time. In its recent meeting, ACIP characterized the situation as there is no data or circumstances currently in existence to merit a discussion about making any recommendation for a booster, notwithstanding any announcements from vaccine producers about availability or forthcoming availability of such a product. So if and when boosters are recommended, we will forward that and communicate it broadly. In the meantime, we continue to support vaccination efforts in the county and want those of you who are not yet vaccinated to get that shot as soon as possible. Finally, and last but not least, I know there's been a lot of discussion in my comments and all of our recent briefings about COVID-specific vaccinations and healthcare, but I really want to emphasize also the importance of routine immunizations and healthcare, particularly for children and adolescents. Many families have delayed routine health visits during the pandemic. Please, if you haven't done so, make a plan to get your child or children in to see their healthcare provider this summer before school gets started up. And sooner is better if at all possible, because there's going to be a mad rush at the end of the summer for people who haven't been able to get that done yet. So sooner is better. Particularly during the early months of the COVID pandemic, there was a significant decrease in children being taken in for well child visits, and that created a deficit of kids falling behind on routine immunizations such as measles, mumps, rubella, whooping cough, and other life-saving vaccines. In addition to vaccinations, during well child care, children receive other assessments and preventive care, and parents and guardians receive guidance on children's health that can help identify and address concerns early on. So I can't overstate the importance of these routine healthcare visits for children and adolescents. Be sure to check with your child's healthcare provider on missed vaccines, overdue visits, or other items they need to catch up on. I encourage you to call today to make that appointment. So with that, again, I'd like to thank you and our county partners, and I'd like to turn it over to Jason Biermann with the Snohomish County Department of Emergency Management. Jason.
Thanks, Dr. Spitters. Thanks, Executive Summers, and thanks to all of you for all the work you've done to help get this information out to the public. As both Executive Summers and Dr. Spitters indicated, it's incredibly important and has been from the start that we get information out. And so thank you for your help with that. Our Emergency Coordination Center activated on March 1st of 2020 in response to COVID. And today marks the 500th day of our activation in response to the pandemic. So I'm going to take a little bit of time to look retrospectively and then talk a little bit about what the response looks like in the future. I will say that we do plan for most of the folks in the Emergency Coordination Center. Friday will be the day we stand down most of the folks. We will continue to do some work with ensuring that reimbursements for our partners occurs and that demobilization of all of our vaccination sites continues seamlessly. But for most folks, their activation and their work within the Emergency Coordination Center will end on Friday. That doesn't mean that COVID is over, as both Executive Summers and Dr. Spitters indicated. For us, it simply means that we're moving from the response phase into a phase of the crisis that's more focused on the recovery from all of the effects and all of the impacts of COVID-19. But just to look retrospectively for a minute, in the 71 weeks, the 500 days since we activated, we've had 199 people from 18 different agencies, county departments, the health district, of course, our fire and EMS partners, city partners, and private nonprofits who have worked in the Emergency Coordination Center. Those folks together have logged over 80,000 staff hours, helping to coordinate all of the things that we've done from this location in response to COVID. And I just want to highlight a couple of those. Some of these I've mentioned, but I think it's important as we sort of look retrospectively. The folks here have secured 21 million pieces of personal protective equipment that was used or made available to our community's first responders, to our healthcare providers, to businesses. And it's important to note that they did that during a worldwide PPE shortage. They were also able to establish an isolation and quarantine facility that provided a safe place for over 300 people to isolate or quarantine themselves and reduce the risk of spreading COVID-19 in the community. They set up and ran the Nourishing Neighborhoods program, which brought fresh local produce and other food to our communities that were most in need and most at risk of being able to access food safely. They worked with partners in our area school districts to ensure that we could keep the school food programs going. They also work to provide childcare for hundreds and hundreds of families of essential workers, so that childcare was made available with our partners at the YMCA and the Boys and Girls Club, so that our essential workers could continue to go to work and do the very important work that they do. They also, of course, did the vaccine task force work. And just to highlight some of the task force work as we ramp that back down, that was our most effective weapon, as Dr. Spitters indicated, and it will continue to be vaccinations for our community. Through the end of June, we've had 1,777 staff and volunteers from 25 different agencies that have been part of the vaccine task force efforts. Those folks' hard work have had a huge impact in the almost 875,000 doses of vaccine that have been administered in Snohomish County. And to put that in context, there's now about 425,000 people that are fully vaccinated, which is just a couple of small towns shy of all of the population that lives within our cities, towns, and tribes. So right now we have 2/3 of the county that's eligible for vaccination, has at least begun the vaccination. As Dr. Spitters indicated, for those of you that have begun, please finish the second dose. For those of you that haven't, please start your regimen. If it's 1 dose or the 2-dose regimen, please start and finish your regimen. COVID isn't done, as has been indicated. And I think it's important to note, looking into the future, nor are our other hazards that we face. The record-breaking heat we just experienced led to multiple deaths in the community. As Dr. Spitters indicated, a huge spike in impact on our EMS system and our hospitals. But COVID also complicates that, because folks are forced to congregate if we bring them into things like cooling shelters. So folks who are vaccinated are less at risk for spreading COVID-19. So it's important that vaccination occurs, because COVID-19 now underlies all the work that we're doing. There's a burn ban in place here and across the state because wildfire risk is elevated. The wildfire season has arrived much earlier, and there's a very strong likelihood that we're going to start seeing smoke and diminished air quality in the upcoming weeks. So again, our other hazards are still out there. Soon, within the next few months, if we have our historic weather patterns, we'll start to experience our fall flooding. And throughout the COVID crisis, the folks here at DEM have been paying close attention to everything that's been happening, continuing to plan and coordinate our response, not just to COVID, but to all of these other hazards. And I'll just end with, fundamentally, we need everyone to do the same. As we go forward, we live in this beautiful community, and it is amazing, but it also has a number of hazards, not the least of which is our earthquake hazard. And our resilience really comes from our individual residents and our neighborhoods. So I'm asking folks to make the choice to be prepared. Preparation for COVID, preparation for earthquakes, preparation for a large snowstorm or a windstorm, much of that looks the same. Do what you can to prepare an emergency kit, to keep at least 2 weeks of food, medicine, and other supplies in your home. Prepare your home for extreme heat if you can. Limit your risk from smoke and other things. All of those things are things that we can do, and every little bit, understanding that not everyone can do everything, every little bit that anyone can do in our community helps all of us become more resilient and better prepared. So I just want to say thanks to all of our partners, thanks to all the residents who made choices during COVID, that supported us, from wearing masks to getting vaccinated to social distancing. And again, thanks to all of you who are choosing to just be prepared for all of our hazards. And thanks to Executive Summers and Dr. Spitters for the partnership and support throughout the last 500 days of ECC activation. And that's it for me. I'll turn it back over to Executive Summers.
Thank you, Jason, and thank you, Dr. Spitters. And I want to give a special shout out to Eric Scheer, too, our interpreter. Eric, it's been a pleasure working with you, and thank you for the great service you've provided here.
Thank you.
So first question, we've gone over some of this, but how comfortable are you guys with current conditions involving vaccine hesitancy and the spread of new variants? And there's our concern as we wind down these briefings, and I think we've expressed some of that, but I'd just like to say that I am concerned, but I'm concerned mostly for individuals and families It's quite clear at this point that the new variants that are emerging are really focusing on and taking advantage of folks that are not vaccinated. And I've got a very close dear friend who lost both his grandfather and father to COVID. I know what a horrible thing that is for families and individuals, traumatic, and it's a hurt that will and a hole in their lives that will be there forever now. And I just ask people to really, if you're hesitant about the vaccine, take a look at the science. The vaccines are safe, they're very effective, and they're really our our best path forward. And so I'm worried about those people that just do not want to get vaccinated. So that's where my concern lies. Doctor, would you like to add anything?
Sure, Executive Summers. And yeah, the number one concern is the gap between, ideally we'd want everyone vaccinated in the county. Obviously, we can't get to the kids under 12 yet because there's no product yet approved or authorized for them. But all the rest of us have that opportunity. Some it's easier than others, and some of us are more reassured by the science than others. And that's why I encourage, at some point, me saying safe and effective, which it is. I don't know that there's a vaccine out there that has a better benefit to risk ratio, and yet we all get all these other vaccines, flu vaccine and tetanus and all that all the time. And this, it's new, and I understand that. So for folks who are hesitant, I think talking to your healthcare provider is really important. And I think that much of the progress that we'll make from here in closing the gap between where we are and higher level or complete coverage will be that one-on-one between healthcare providers and patients, working through working through questions that folks have or concerns they have.
Jason, anything to add?
No, you all covered it well.
Okay. For Dr. Spitters, could you talk a little bit about the future of COVID testing and contact tracing? Will sites stay open indefinitely, or we're going to move more to healthcare settings or other?
Right. And and that also ties into the where are things going as we move ahead into the fall and winter. So testing at the peak of the third wave back in December, we about 18 to 20,000 tests were being done weekly, with the health district sites providing about a third of those, 6,000 tests a week. Now demand is way down. Countywide, 7,000 tests were done the last week of June. So that's 1/3 of the peak during the pandemic. And our proportion of that is much lower. We're down around 1,000 or 1,000 tests. So that's 15% of the total supply. So by natural forces, most of the testing that's occurring is now migrating into routine healthcare settings. And I think that's fine and what we anticipate to occur in the long run. Having said that, we remain interested in maintaining containment efforts until we're quite a bit further down the road. So we're prepared for another wave of activity. We've got the testing site on Broadway in Everett and one at the Linwood Food Bank. We're going to keep running those for the foreseeable future at this time. And of course, our contact investigation and isolation and quarantine efforts with cases will continue.
Thank you. Next question is, with the $1 million lottery drawing today and the military drawing next week, sort of the state incentives, any recommendations on future incentives to encourage people to get the vaccine? And sort of as a follow-up, do we expect any uptick in vaccinations as unvaccinated people realize the variants are truly a danger to them? And I'll I'll start by saying we are continuing to explore and encourage positive incentives, working with businesses and encouraging them to, there's been some businesses that have put forward some free beer or free meal for getting vaccinated. And we'll continue to encourage those and work with folks. We are still focused on getting vaccines out to populations that may have impediments. They have to work, might be a little hesitant as a community. We're continuing to do outreach efforts, and we will do that and look for any positive incentives we have. And I do see some indication, just anecdotal on social media, that the surge in unvaccinated populations does motivate some people, and hopeful that it will motivate more people. But we'll be there to get vaccines out to people and try to facilitate that as best we can. Doctor, any thoughts on incentives?
Well, yeah, I'm not a great behavioral health specialist, but I think that, the types of incentives Executive Summers mentioned, I think are helpful for many people. Not everyone will respond to material incentives, but for those, I can think of no greater incentive than the kind of story that Executive Summers just told about, trying to avoid a situation where a loved one gets sick or dies. And so, for me, I have vulnerable adults in my household. I don't want to bring that home to them. So even though, even if I weren't the health officer or medical doctor, what would really drive me to get vaccinated would be protecting that person and my family, and as well as the other folks around me, but particularly the most vulnerable. And and I do think that, I suspect that, whenever there's a sort of an alarm signal going, whether it's increasing cases or spread of a new variant, that might well encourage some people who respond to fear. It may not catch everyone, but all these things together hopefully will gradually move us forward and close the gap.
Thank you. Jason, do you have any ideas, thoughts on incentives? Anything you're working on?
I just wanted to add, I think one of the powerful incentives, in addition to what Dr. Spitter said, is also, with the vaccine hesitancy, having folks who are willing to share their stories of safely getting vaccinated. A lot of the power of that is folks hearing from friends, from loved ones, from people they trust that they did get vaccinated. So again, sort of that personal incentive, I think, is one of the more powerful things that we're hearing about, as well as people who are willing and vocal to say, I went and got vaccinated and it was just fine, and I'm fine, and now I feel protected. So I think, a powerful incentive is just simply sharing those stories. So for our folks out there who are fully vaccinated, which again is luckily a good percentage of us, share your story about how well it went. And I think that's helpful as well.
Good one. So with no vaccine yet available for ages 12 and younger, any predictions on outbreaks in elementary schools this fall or in school settings, Doctor?
Well, predictions, it's always difficult, but, if past is prologue, looking back at the spring, yes, we saw cases occurring in schools. Now, having said that, at any one time, in the county, we might have somewhere between 20 and 30 schools with K-12 facilities with one or more cases in the building. Now, that doesn't mean they were transmitted in the building. Most of the case, clusters we see are not really outbreaks. They're 2-3 cases, rarely more than 5 cases. Again, speaking to what we've witnessed here, as well as scientists have demonstrated around the country and around the world, which is that although transmission can occur in the school setting, it's quite rare. Usually the percentage of contacts of a case in a school that are infected from most studies is less than 1%. And a lot of that is due to the prevention measures that our school partners have been so helpful and rigorous in standing up. So that is likely to be part of K through 12, especially for unvaccinated kids. But all those prevention measures are likely to still be in place as we move into the fall, and then hopefully look forward to opportunities for younger children to get vaccinated when a product comes forth, maybe sometime toward the end of the year or beginning of next year, our current rough predictions. But meanwhile, I think the prevention measures will largely remain in place that were there last spring.
Thank you. And so our last question really, is there anything the county could have done better? And I'm going to jump in first again here. I think there's always things that we can do better and improve on, across the board. And I think it's important that we take the lessons we've learned and the experiences we had and use them to be even more prepared next time. I honestly have no examples that I can think of where I go, oh gosh, we should have done this or we did that wrong. I'm so proud of the team. And the health district was prepared, ready. My Department of Emergency Management trains and practices, and I think learned many great lessons from the OSO landslide a few years ago. And so we were pretty ready, but I think you always look back and you say, okay, there was this could have been better or more efficient. I think from my standpoint, the relationship with the local governments, both the health district and the county and our cities, and that relationship and communication with the state level planning and the federal level planning, there were obviously some maybe lags and lack of communication at certain points. It wasn't disastrous. I don't think it was terribly harmful. It was a little frustrating sometimes and could be improved on. So we'll take the lessons and experiences and really make sure that we double down and work on those as we come out of the pandemic, so we're ready for the next situation. Jason's been planning on what's next. We've got fire season on us, and then we have the winter storms, and there's a lot of challenges in front of us, but we'll take these lessons and build upon them. And hopefully be even better next time. But honestly, I'm very proud of everybody. Dr. Spitters, any thoughts?
Yeah, I mean, I think locally the collaboration and partnerships were fantastic, and I can't think of any kind of glitch that I regret having been part of or witnessed in that respect. I think as a society, at the broader level, beyond government, I think this was a very new thing, that called for drastic measures. In a way that we had never had to impose anything like that, certainly in my lifetime. And so I think, there was some reticence to kind of launch, early on, bold and drastic measures, far-reaching efforts, and that was nationwide. And I think next time around, we'll be quicker to take those bold actions, however uncomfortable they make us feel. That's the main thing I take away from it.
Jason?
Yeah, I appreciate both of your responses. It's I think for the most part, we look at every incident and try and glean our lessons learned, because there are always some things that we feel like we can do better. I'll just highlight a couple of things, even as we look into the fall and moving forward. Part of what we're doing right now when I talk about demobilization is determining what level of PPE we're going to maintain and where we're going to stage it, so that we have personal protective equipment readily on hand. So if unfortunately there would be another massive supply chain issue, we will have a stockpile here, and it will be positioned so that around the county, so it's not all in one location. We're looking at things like also having the resources, the kit kind of available and set up or ready to set up for mass vaccination sites if there was a need to assist for boosters or something in the future, just so we have those things. So we've already taken some of those lessons learned, and that's part of our planning going into the fall and beyond. So yeah, there are certainly things that I think we will look at, and part of our process once we get through kind of the end of this response phase is we'll take a more holistic look with some folks from the outside to kind of guide us through what we call our after action review process. And we'll have some things that will determine we can do better. I would just highlight, and Dr. Spitters touched on this, it goes back to my earlier comments. I think we as a community, as a county, have to look at what we all need to do to be better prepared, because we do have these other issues. And so I think, you know, one of the lessons learned, I hope, for all of us is these large disasters can strike at any time with little warning. And so some level of preparation, again, knowing not everyone can do all of it, but whatever level of preparation you can take helps when disaster does strike. And I did say when, not if. So I think that's an important thing for all of us coming out of this.
Yeah, I guess I would just add that fully intend on, while the experience is fresh, to emphasize to my council and our mayors and city councils and agencies that the importance of this work, the absolute critical nature of the preparatory work that's happening all the time in the background that most of us never see. But if you don't do that preparation, you're not ready when disaster strikes. And so I think I mentioned we had the experience of the Oso landslide, so we had some experience fresh in our minds, but it's absolutely critical that we support the emergency management preparation work that goes on every day behind the scenes and make sure that that system is strong. And it was strong, but we need to make it even stronger. So I think with that, that's the end of our questions. Again, I want to thank all of you in the media for being here and really playing such a critical role in this, getting information to the public. And I, again, appreciate it.
Thank you all. This is Carrie in the Joint Information Center. Appreciate you staying a little longer so we could get through the questions. Thank you again for all of your work. And if there are media availabilities like this in the future, we will definitely let you know. Have a great day.